Welcome to the show. It's Senior Happenings. My name is Trisha Ayers, and I'm very excited to bring our guest today. My first guest is Michelle Brock, and she is the administrator of Highlands Health and Rehab. Hi, Michelle.
Hi.
How are you?
I'm so excited to be here.
Thank you. I like that shot that they gave us there. I thought we looked very professional.
Of course.
I love that. So Highlands Health and Rehab, you had to come just a short hop, skip, and a jump down the road.
I know. I had to drive almost a mile.
I know, in the
almost.
rain.
In the rain.
So, Highlands Health and Rehab, I know it as rehab and nursing home care.
Absolutely.
But you have an exciting announcement that I need to dive into straight away.
Absolutely. Well, we still have the rehab, we still have the long-term care, but we have just opened a new memory care observation unit, and we're so excited. So excited.
Just opened, meaning?
2 weeks ago.
Wow, brand new.
2 weeks. Brand new. Fully renovated back there. We've got 23 beds. And so we're about half full now. We've been open 2 weeks, and so we've got several people moving in from out of state. We're so excited to have them here, and it's really needed here.
I'm so glad. We know that there is a need, especially in our area. People who need to put a loved one in memory care would like to stay a little closer. So if you're in the Bella Vista area and the Bentonville area, it's a great location. How did that come about? What was the procedure of, okay, we're doing this, but we know we need to add memory care?
Bella Vista is such a unique community. I mean, it's not like a lot of the other communities in Northwest Arkansas, but we want people to be able to stay here. And so we've been talking with so many families and meeting with them, and one loved one's here and they're having to move their spouse to memory care in another town or another county even. And you know, whenever you're a senior, that might make it a little harder to go visit like you want to and get to spend the time that you want to spend. So we wanted to bring that here to Bella Vista so that we can keep the residents of Bella Vista here.
And let's go back a little bit, and when we talk about memory care, what's the criteria for memory care? Because some people might not know.
So we do have some flexibility with that. Our unit is designed to take care of people with Alzheimer's, other dementia, or cognitive issues that cause them to need a less stimulating environment. So it's a safe place. They can wander all day and they can wander all night, which is key. You know, a lot of them with the sundowners spend a lot of time up at night, and that's exhausting for the families, but luckily we're up all night already. So.
And I know we talked earlier, you have been in this profession for quite some time.
Yes.
And we talked about a little bit how memory care has changed so much as to what we thought memory care was even 10 years ago, maybe.
10 years ago, 20 years ago.
Yes.
It's such a difference. Our unit is beautiful, it's light, it's open, there's room to wander. Activities are all throughout the day. All of the staff are trained on activities and keeping them busy and giving them options on things to do. So it's not your 10 o'clock bingo and nap in bed. And it's not the way that it was once perceived. I mean, it's a wonderful unit. The staff are very well trained, and there's always something going on.
Wonderful. Yes, we talked about that a little earlier. I so love that you do have, and you said you have breakout activities that happen. It's not just, okay, this is our structure. They take an opportunity to go, okay, let's create an activity here because we see a need.
Absolutely. And we get to meet with all of the families when they come in and learn what kind of hobbies they had, what kind of things they like to do, so that we can really cater all of the activities around them. I mean, not everyone wants to play bingo and not everyone wants to paint or cook, you know, so we can just definitely at the turn of a hat turn and grab any activity for anybody that's in there that kind of caters to where they're at.
Right. And I know that we have some photographs to show.
Yes.
When we have a minute of just the joy in the eyes of people. I love that.
We had Fiesta Day. We had Fiesta Day. Last week was Nursing Home Week, so every day we had different themes. So Fiesta Day was definitely a fun one. We had a soda tasting contest for the different sodas from Mexico.
I love that.
Yes, she's my diva over there. She didn't miss any days of dress up for the week. So Frito Chili Pie Day, we had our Cowboy Day, and we got Frito Chili Pies for all the residents and the staff. That's me and our Director of Nursing, Wendy. Cowboy Day, of course.
I love it.
And just some of our arts and crafts activities that we were able to do through the week. And we're planting flowers there. Some of our amazing families. We have a lot of great families here, really, really great families. And they can come in anytime they want. I mean, we don't have set visiting hours. We'll feed them. They can come in and eat lunch with your loved ones and get to be the daughter or get to be the spouse and instead of the caregiver and really enjoy your time with your loved ones.
Family support is so important.
Absolutely. We involve them every step of the way.
Your staffing and the training, can you talk a little bit about that, how you're staffed and the training that goes in?
So we have a plethora of CNAs, LPNs, RNs, you know, we have all of those things, and then we also go through everyone now before they get to work in our observation unit has to go through an additional Alzheimer's and dementia training. And so we have nurses that come in and do that training for us from outside training models. I mean, and we do continued training along the way. And so we've definitely got that. We also sponsor CNAs. So if there are people in the area that are interested in getting into the healthcare field, we can sponsor them and help pay for that all for them and get them started on the right path. It's a great resource for the community, you know, and especially with all these kids graduating now.
Yes.
I know.
Yes.
They're ready.
And I know they have the Ignite program that goes on in the schools where some of the kids came out
already certified.
Yes. What a great way to serve your community, too.
It is. It's wonderful. So we really enjoy it, and it's a good place to grow up. I know my kids grew up in the nursing facilities. I grew up in them. So when you have that passion for that, you know, we want to be able to accommodate.
So, Michelle, what is your background? Can you?
I have worked in healthcare.
Oh, dear. I have worked in healthcare.
That's all I've ever done. I mean, as soon as I volunteered at nursing homes whenever I was in high school, and the little nursing home I worked by or lived by, they'd come pick me up on their nursing home bus and bring me to volunteer because I couldn't drive yet. And then when I turned 18, it was CNA, social services, marketing, admissions, you know, kind of worked up the ladder to right where I need to be.
What a great background, being the admin, that you've done all the jobs.
There's not a job I haven't done.
You've done
or
all
that
the
I wouldn't
jobs.
do.
Right.
That I wouldn't help them do.
Absolutely.
So, yeah.
Absolutely.
We have an amazing team. So.
Now, your memory care observation, I love that word. Are you co-ed? Are you male and female?
We are co-ed. So we have male and female rooms back there, but there's lots of space. So that makes it really nice. And a lot of our units in the area have gone to one gender or another. And so it makes finding beds difficult sometimes. Like we've really struggled with trying to find placement when people have needed it in the past.
Right.
And so, yeah, we can absolutely accommodate either one.
If somebody is at home and they're looking after a loved one that may have some cognitive issues or dementia and Alzheimer's, what would you say to them to encourage them to come and visit and see what you have to offer?
Absolutely. Come visit. I mean, all you have to do is come visit, and you'll see. I mean, it's so important, and there's no price you can put on being a loved one instead of a caregiver.
Yes.
It's exhausting. And a lot of times the person providing the care goes downhill very quickly. Physically, it's exhausting, and you can't keep up with yourself when you're keeping up with someone else around the clock.
Right.
You know, and it doesn't even have to be forever. We also have respite. So if you're taking care of your loved one and you need 4 days off because you want to go to somebody's graduation, we can even accommodate that. We can start in baby steps if we need to. But, you know, accept the help. Be the loved one. Get to sit and eat lunch with them and enjoy activities with them and go outside in the courtyards with them and enjoy those things that you may not get to enjoy when you're a full-time caregiver.
So a family can reach out and can they schedule a tour and come speak to you?
Absolutely. Call anytime. Stop in for a tour. I think you guys have our information there.
Yes.
We're happy to show you around. We also have an open house coming up at the end of June.
Okay.
So we'll be giving plenty of tours that day and feeding the community. So you can come by and see the facility and get some free lunch too.
Okay. The question always, how do people pay for this? What are the forms of how people can pay for this?
Okay, so we're set up to take Medicare, Medicaid, private pay, and long-term care insurances.
Okay.
You know, Medicare is not a forever thing. We all know it doesn't pay for nursing care forever, but, you know, if they're coming out of the hospital and you need some rehab and you need to get stronger, then you've got that as your first step while you're deciding if you need to stay or if home's going to be the better option for you.
How many days do you get with Medicare?
It's up to 100.
Okay.
Now, of course, there's a lot of rules along the way, and you know, they have to meet certain criteria, but we'll do our best to keep that going. And we take a lot of the other managed care policies that are in the area too.
Okay.
So if you're going in and you're having that hip surgery, you know it's coming up, then give us a call. We can tell you if we take the insurance and what it's going to cover, and we'll help get all the pre-certifications and authorizations and everything arranged so that you can get that rehab you need.
So private pay, Medicare for some of it, Medicaid, and long-term care.
Insurance, yes.
Insurance. And I would definitely advise people, if you have long-term care, read the policy and maybe go see Michelle, because I'm sure she's read a few long-term care policies along the way, and they're all a little different.
They're all a little different, and a lot of our team have been with Highlands for so many years. Our business office manager has been there for almost 20 years.
Oh my goodness.
She's amazing. So if you've got that insurance, that weird question, do I qualify? What's covered?
Yeah.
She has an answer to
Definitely
it all.
ask questions.
Absolutely.
We want people to be educated and informed and know.
Come, take a tour, ask all the questions, and then get in your car and remember that you forgot 5 of the questions, and call me back and ask them again. You know, I mean, we're here for you, whatever you need.
Go hunt for those documents, because you may not know that you have long-term care policy.
That happens all the time.
Yes.
Mom had been paying on it for years, and the kids didn't know.
Right.
Yeah. Absolutely.
So I know I work in an attorney's office. I'm not an attorney, but I know in our office, and I'm sure that's helpful for you guys, powers of attorney are really important.
Yes.
For your establishment, for people to be able to make decisions, and for you. So I would encourage people, please have it. And I'm sure that's something that you check.
Oh yeah, absolutely. We'll check that, and we can help guide them in the direction if they don't have it. We definitely need to get it if you don't have it. So we'll definitely help get you the resources that you need to get that taken care of.
But you need to be able to get the help from the family sometimes if the person you're going to be caring for.
Absolutely.
Yeah. So tell us something else. What can you tell us?
Well, we have partnered up, and so the Schmeeting Center, I know, is very exciting, is bringing the Alzheimer's experience to our facility July 1st. So, and that is it's a dementia Alzheimer's stimulator, so they can you can see what it's like to see through their eyes.
Right.
And so all of our caregivers are going through that, and we're also opening it to the community, so you guys can come into the facility and see what it's like to live with Alzheimer's for a short period of time.
That's an amazing thing, and I think it gives you a lot of empathy and realization of some of the limitations that continue to go on. That's amazing.
I'm so excited.
Schmeeting Center's coming. We love the Schmeeting Center. I love it.
We do. So those will be 20-minute sections. So you're going to have to sign up because people are already starting to claim their spots.
Yes. So you have an open house coming up?
Yes.
Which
the
is
last Friday in June 28th. And then the Monday right after, we'll roll into the Alzheimer's experience, so you can sign up while you're at the barbecue and come back on Monday
There'll
and
be
do
barbecue?
it. Absolutely.
Okay, everybody, mark your calendars. We're going to that. We're going to go to that. Michelle, I thank you so much for taking time out of your schedule. I was especially so ecstatic that we have more memory care options right here for our folks, and glad you're at the helm to run it. Thank you. And just appreciate you and what you guys do there.
I appreciate you guys, and this community is phenomenal. We really appreciate all the support. We do.
Absolutely. I want to thank Michelle for coming in, and we will be back in just a few minutes, and we'll be talking about rehab and Encompass Health. Thank you so much. Welcome back to Senior Happenings. My name is Trisha Ayers, and my guest for this half of the show is Nick Dailey, and Nick is with Encompass Health and Rehab Hospital. Nick, That's a lot.
That's a lot to say.
That's a lot to say.
It's a mouthful.
And your title?
Yeah, I'm a rehab liaison and an occupational therapy assistant.
Okay.
So, yeah, I have a history in occupational therapy.
That was going to be my first question.
Yes.
What's your
yes.
background?
So I originally was a teacher and a coach, and then I eventually found my way to the healthcare field, and so I provided occupational therapy in nursing homes. So actually, the company I used to work for provides services in your previous guest's home. So I used to do, activities of daily living, walking, balance, all that kind of stuff for more of the elder population.
Okay. And then you moved?
So then I eventually moved to this role. So now my role is more finding a patient that needs inpatient rehab and helping walk them and their family member through that process and get them into our hospital so they can increase their function and just to increase their overall function so they can discharge back home.
Sure. So tell us a little bit about Encompass. I know they are partnered with Washington Regional.
Right. So we are formerly Health South. So we were Health South for several years, and then about 8 or 9 years ago, we remarketed, and now we're Encompass. So we provide inpatient rehab. So what that looks like is that's 3 hours of intense rehab a day. So speech, occupational, and physical therapy. So this could be someone that's had a stroke. It could be someone who has Parkinson's. It could be someone who has fallen and had a hip fracture. Mm-hmm. It could also be someone who's just had a decline or maybe some other medical event that they're not quite physically functioning like they should be.
Mm-hmm. Does everybody have to come through a doctor's referral?
So there's different ways to be referred.
Okay.
So someone can be referred through like their clinic physician, so like a Mercy clinic, like a typical family practice care.
Okay.
But we get the majority of our patients probably from the hospital setting, like from acute care into us. But there are other ways you can be referred as well. We've had people, I know Michelle, who was on here previously, they have a memory unit.
Yes.
So, in Northwest Arkansas, there are some specific memory units. We can get a referral from them. We also get referrals from home health. So let's say someone's at their home, they're getting home health 3 times a week, and they home health decides they still need a little bit more. We can only come out here 3 days a week. We think they need more therapy. They send that referral to us, and then we try to get them in our hospital.
Okay.
Yeah.
So coming through the hospital system, somebody's had a fall or something like that. They want to go into your rehab hospital. They get referred by their physician. Is it a straight move across to rehab hospital?
It depends. So some of that is dependent on, we live in this world now where you have Medicare and you have the managed plans. Typically, traditional Medicare is an easier process to get approved.
Okay.
The commercial insurance, we accept all insurances, and we're in network with the VA, but the red tape of that takes a little longer to get approved. So sometimes it is a straightforward move, but it may take 2 or 3 more days to get that approval from the commercial insurance company or the managed plan.
So what can families do to advocate that? Do they just need to ask ahead questions?
Yes, and I would say that every situation is different. So I'm sure many residents in Bella Vista might be on a managed Medicare plan or a supplement plan that might help them pay with their prescriptions and things of that such. So I would never tell someone to change their plan. But sometimes I have had patients in the past change from a supplement plan or a managed care plan to traditional Medicare. There's dollars and cents differences there. It's really the approvals and how quick they happen.
Right.
So
and again, we are not telling people.
We're not telling anyone. We're not giving anyone advice.
No.
At all.
We're not giving advice.
But that's those kinds of things. Every situation's different, like I said. So
education, ask good
yes,
questions.
and like you were saying with your previous guest, people should really read into things and get as much help as they can, because a lot of times people just don't know either what they have or the extent of what they have covered.
Okay. And if somebody comes into rehab hospital and they are at a point where they're ready to be discharged.
So at that point, our case management gets with the therapy team and the physicians, and we kind of determine, okay, if this person goes home, or they're probably going to get home health upon going home. But if that patient is strong enough to get themselves to an appointment, then we may refer them to an outpatient, some outpatient therapy.
Okay.
Just depending on the situation. We're really working to get those things lined out to where we know what's appropriate and not just giving everyone the same thing.
And then, heaven forbid, somebody goes back home and relapses.
Right.
then what happens?
Once again, every situation is different, but typically if someone goes home and they've been home from, there's like a 3 midnight rule, but typically if they've been with us and we can prove that they've had a significant decline again, usually we can get that approved.
Can you talk about the 3 midnight rule?
The 3 midnight rule, so with Medicare, there is no 3 midnight rule.
Okay.
So like if someone wanted to come from home to us or from a clinic, we can usually admit them the same day.
Okay.
Now, sometimes with these managed care plans, there needs to be, if they've gone to the hospital or something of that nature, they need to be there for 3 midnights before they get approved to come.
Okay.
There's more to it than that.
Yes. Yeah.
But that's kind of the basis of it.
Right. I know we have some photos to show that
Yes,
you...
I want to talk about
Yeah.
our stroke program.
Yes. So if we can... there we go.
Yeah, so May is Stroke Month, so we are Joint Commission certified for stroke therapy. So what that means is in our area, we've been a designated stroke center since I think 2010, and this year and in 2019 we were awarded Stroke Center of Excellence. So when you get awarded Stroke Center of Excellence, there's many criteria you have to meet. It's about 20 different types of criteria, and it's usually outcome based. So basically, if someone comes to us with stroke, we discharge. We're really happy about sending them home 86% of the time, or back to the community.
Wow.
So if someone comes to us for stroke, on average, our statistics have said that we've kept them for an average of 2 weeks, about 14.4 days, and then we've gotten them back to their home or assisted living. We try our best not to discharge to long-term care. We want to get someone that's had a stroke back on their feet,
Yes.
or at least on that road.
Yes.
So I've kind of gone by your photos there, but we have several technology pieces with that that typically deal with ambulation. There's the vector system here, so that basically is going to help a patient that could have had a stroke or a spinal cord injury, help them ambulate in a setting to where there's no fear of falling. They're harnessed in. They can work on their gait pattern with, basically no fear. And try to relearn those motor patterns and all those things. It's a really cool piece of technology. We also have, sometimes when someone has a stroke, they have one-sided spasticity, it's a hard word to say, or they're high tone.
Yeah.
So we have a machine that can help kind of relearn the tensor muscle strength, all that kind of stuff. Very neurological. We also, we don't have an on-staff neurologist at Encompass, but we can consult with neurology and have
Okay.
them come in and look at that patient for just an extra level of care.
Okay. I loved the photo of the harness because I think being fearful...
For sure. Huge with the older population,
Right.
whether it's a transfer or ambulating. So we have the vector, and we also have what's called the light gate. And both of those technology pieces basically help someone relearn how to walk, get confidence with standing, get confidence with their balance while they're in a safe environment where they know I'm strapped in, I can't fall.
Right.
So that's a huge thing with the older population, that fear of falling.
Absolutely.
Which is understandable.
Yes.
If you've fallen once, I don't want to do that again.
Right.
So we have those technology pieces at our hospital, and we're very proud of those because they really do help.
Because we love our nursing homes and we love the care
Sure.
that they give, but we would like to keep people out as
Yes.
long as we can, and we don't want a fool
Absolutely.
to put somebody in a nursing
Right.
home. So,
Right.
What do you do? I'm asking all these
No, you're
questions. So somebody falls or they have a stroke, they come in, they rehab, you get them to what percentage is the...
So our stat, so when someone comes to us for stroke, 86% of the time we're either discharging them home or to independent living, assisted living.
Wow.
Yeah, so that's really the biggest stat that we are very proud of because we want, our whole purpose is to help them recover and get them back as
Sure.
close to their prior level of function as possible.
Absolutely. That's really good.
Yeah.
That's
So
really good.
that is something that we're very, like I said, Stroke Month, we got Stroke Center of Excellence. We're really proud and just want Bella Vista to know, we are a little bit of a drive, but we can
Right.
help you.
Absolutely. And with those statistics, why would you not want
Right.
that help?
Right.
That's great.
Yeah.
So, other things, I was on the website, the Encompass Rehab, and so another thing that I didn't think about, interpreters. And if you're Spanish speaking?
Right. We have, and that's another thing that we're working on. So we have a lot of cut sheets and not technology, but cut sheets, and we have we have a system that can
Right.
translate, especially in the Rogers, Springdale area. We
Sure.
do get a high amount of, Hispanic, Latino, Marshallese.
Sure.
So we do have translation services, and I will also brag, Mercy Hospital and Washington Regional also have those services too, and they're very easy to use.
Good.
You get a translator on the phone. I've never had an issue with that, and it makes it so much easier. But we are making a big push to have, just a huge amount of educational pieces and cut sheets
Right.
that are in Spanish or other languages. So it just makes it that much easier.
Right. If people are doing their, I don't know, rehab hospital shopping, can they come and get a tour?
They can get a tour, absolutely, absolutely. I would just call our main number. I think it's 479-444-2200. I could be wrong. I thought that was
Good
right.
memory.
Yes, and no, we'd be happy to give anyone a tour. We have a big courtyard in the back. We're right across the street from Washington Regional, so we're easy to find.
Right.
And also across the street from Highlands Oncology. So we're also centered there where if people need to be referred or consulted with Highlands, we're right there. So
Right.
that makes it easier if you have a maybe high complex patient that has fallen, but they also are doing cancer treatments. We're right there. So
Right.
we're happy about that.
Always encourage people to get education on whatever subject, and especially as we age, you have to look at those kind of things. You have to
Absolutely.
look at rehab hospitals to make that good choice for you and your family.
Right.
Is there anything else you want to tell us about Encompass?
Just that, we've been here for 30 years. Like I said, we were formerly Health South.
Wow.
We have a great rehab team. And right now, our outcomes, so basically someone coming to our hospital and improving at dressing, toileting, bathing, walking, balance, out of like 800 inpatient rehab hospitals, our outcomes are like top 15. So we're really proud of our therapy team. They do a great job.
Nice. And know that those resources are there before you need them.
Sure, absolutely.
Which is hard to say, but I know that Nick and myself and all the rest of us in senior healthcare really try and do a good job of educating.
Sure.
You guys were at the Senior Expo. I know you'll probably be at the
Yes,
full Senior
we will.
Expo.
We will.
Do you have educational events that happen at your?
We actually, for stroke, we have support groups for both patients that they're in our hospital currently for their family.
Yes.
So we have stroke support groups and we have amputee support groups, and we're working on getting certified in amputations and spinal cord for Joint Commission. So
Okay.
we'll have more of that as well.
Perfect.
And we'll always have like an individual therapist that usually runs those groups.
Excellent. Nick,
So,
thank you so much for
thank you,
joining me.
Tricia.
Thank you for the education. May is Stroke Month.
Yes, ma'am.
Don't have one.
Don't have one, yeah.
But we're going to put some spotlight on it. And thank you for joining us today, and we will be back next month with more senior happenings.